Hey guys, welcome back to my channel. My name is Miranda and I am a circulating nurse in the operating room. So today I wanted to make a little video about the pros and cons of working in the operating room as opposed to working in ICU or med-surg. So if you're interested in that, then just keep watching. So this question was asked by 2012 TCD. She works as an RN in a neuro ICU and she's been thinking about transitioning to the OR. Could you do a video about the pros and cons of working in the OR versus working med-surg or ICU? So I made a list of all of my pros and all of my cons, so let me bring that up. Okay, number one pro for me is that I have one patient at a time. You cannot beat that. You're never going to have one patient at a time unless maybe, I guess, home health would kind of be like that. But that is awesome to be able to give all my attention to that one patient and not be preoccupied or stressed out about like something else going on. So that's something that's totally different from med-surg, which is my background, and ICU. Number two, flexible schedule. So they have different shifts in the operating room, unlike med-surg and ICU and other areas of nursing that are in a hospital setting. Typically you're going to be doing 12-hour shifts. In the operating room, you can be doing 8-hour shifts, 10-hour shifts, 12-hour shifts. You can do PRN and just sort of come in to relieve people for breaks and lunches. So I just love the flexibility. Currently I'm doing 5 days a week, but they're only 8-hour shifts. So the day goes by so fast. I feel like I'm done in no time and then I'm still home at a decent hour. Do you know what I mean? So that has been awesome. Number three is the teamwork in the operating room. I know there's teamwork in all areas of nursing, but in the operating room, you literally are a part of a little team. So there's you, the CRNA, the MDA, the surgeon, and the surgical techs, and you're all working together to give the best care to this one patient. Like you're all focused in on this one patient. So that is really, really awesome. I've seen a couple emergencies and it's just so nice to already have that team right there as opposed to working in med-surg or ICU. You're kind of, you're on your own. You're still a part of the team, but you're primarily working alone. Do you know what I mean? I'm sure you kind of get what I'm saying if you work med-surg or ICU. Especially med-surg where everybody has 5, 6, 7 patients of their own, so they may not have time to come and like help you if you're having like possibly an emergency in your room. But yeah, the teamwork in the operating room is awesome. Number four, instant gratification. So the patient comes in and you know that when you send that patient off to PACU, you will have been a part of that team that pretty much immediately fixed the primary problem. So that's really nice knowing that it's something that's fixed like right then. It's not something you sort of have to like wait and see if something's gonna work or not. So that's been really nice. Five, I think I'm on number five, is breaks. You get scheduled breaks in the operating room. And I remember like my first week or so in orientation, and another nurse would come in to our room to relieve us for a break, and this was at like 8:30 or 9 o'clock in the morning, and I'm just like what? Where is this coming from? Like I'm not used to having breaks on med-surg. You get like your little tiny lunch break at some point when you're not running around like crazy, or ICU or anywhere else. But in the operating room, you will get your lunch and you will get a break before your lunch. So that has been very, very nice. I can't think of any other area of nursing within the hospital that you're going to get breaks. So I usually have a little 15-minute break around 9 o'clock or so, and then between 11 and 1 I get my scheduled like 30-minute lunch, and during that time there is a nurse like that is relieving me. So I'm not like being called back before my lunch is over or anything like that. So that is a plus. No call lights and no angry family members. I know one of the most frustrating things about working on the floor in ICU is the family members. The family members can be so overbearing sometimes. The patient can be sweet as pie and amazing, but those family members can just make or break your day sometimes. So in the operating room, you're only going to get like 3 to 5 minutes of one-to-one time with your patient and family member. And since they're in pre-op, they're not going to have their whole entire family up there with them. They're only allowed to have like 1 or 2 of their family members come with them to pre-op. So it's not like you're going to have this whole like family thing going on that you have to sort of manage. So that's been nice. And there are no call lights in the operating room, obviously, so you're not going to have people calling out every 5 minutes complaining that they didn't get a pudding with their lunch, or that they want some cherry popsicles or whatever else non-emergent thing that they need right then. My last pro is that I get to leave on time. So when I was working on the floor, you know, I would get off, it's never 7 o'clock, you know, you have to wait until you've given a report on all of your patients to the next nurse coming on. And if you had anything to catch up on, you have to stay after and catch up on it, whether that be charting or if orders were put in last minute. I never wanted to be that person who didn't carry out an order because it was put in sort of later in the evening. So I always felt obligated to carry out those orders, whether it be a medication that was put in late that they want given, or I don't know, an enema, whatever it is. Like, I did not want to leave anything for the next shift, so I would try to tidy up as much as I could, and that could take me so long sometimes. The earliest I would get out working on the floor would be about 8 o'clock. That would be a really good day. If I were like caught up on my charting and everything like that, I didn't have any very difficult patients, I could get out at 8. So that's an hour past the normal like 7 to 7. And if anything went wrong, there was one day I was there until like almost 11 o'clock at night. So it varied so much. I never got out really on time. So in the operating room, when you're giving a report on a patient, you're giving a report on your one patient, and you're not giving a full-on like H&P history of your patient. You are telling the next nurse that's coming to relieve you, what surgery are we doing, what kind of allergies do they have, where's the count as far as your sponges and your sharps, where is your grounding pad, things like that. So it is not going to take you long to give a report in the operating room. You're going to be giving a report for like a minute max, and then you can get out of there. So that is great. So on to my cons. The number one con for me is the call. All the call that I have to take call once a week, and then 1 weekend a month. So I don't mind the weekend, it's only 1 a month. But during the week I have to take call once a week. And that can be any day of the week, Monday through Friday. And they try to let you pick which day you want to be on call, but obviously, you know, sometimes it doesn't work out and you could be on call on a day that you don't really want to be on call. And what that means is, like, after your shift, you could be called to come back into work. So that's no fun. Definitely, if you're interested in the operating room, find out what their call schedule is like and see if that's something that you would be willing to do, because sometimes it could be very draining. If you're coming in for day shift and then you're on call overnight, you could literally work all day and then some during the night. So my last con, so there's only 2 cons, is loss of nursing skills. So you're not going to be starting all your IVs, you're not going to be fully assessing your patient like you do on the floor in ICU. mostly a lot of that stuff you learned in nursing school you're not going to be using anymore. You're going to be learning a completely different skill set, which I don't mind at all. I really love it. It's a more technical kind of nursing, learning the equipment and learning about positioning and stuff like that. So I love it, but I know a lot of people would find that as a con, because a lot of people take pride in being really good at starting IVs and really good at knowing medications and interactions and stuff like that. For me, I don't mind it because I love this kind of nursing. One thing you will get really good at is putting in Foleys, because probably half the cases I do, I have to put in a Foley. So I can tell my Foley skills have significantly gotten better. So yeah, that is my list of pros and cons. Let me know in the comments below any other kinds of videos you would like to see about the operating room, and thank you so much for watching. I will talk to you guys later. Bye!